Hey gang, this is Dr. Jeff. You're sitting here waiting for me to come in the room and you're watching this video, and shortly I'm going to begin to go over your specific MRI findings. But before I did that, I wanted to give you a general idea of what we look for and how we determine the disc isn't working right and what happens and how we can solve that, and then give you some options so that when I do come in, you'll truly understand what we're talking about, and then we can get right to the solution for you. So let's talk about the disc. Chances are, if you're sitting here watching this video, we were suspect in your examination that you had a problem with your disc. Here's the bone, here's the disc, here's the bone, and then these are the nerves that come out right in between the bones and where the disc sits. So let's first of all talk about how this should normally function, and then we'll talk about how it breaks down. So the bone or the vertebra should sit right in the middle and on top of the disc correctly. And when it lines up correctly, what happens is when you're standing and walking, we have a pumping mechanism. So you can see it compresses and it releases, it compresses and it releases. And that mechanism is very important to the disc health itself. You see, the disc has no blood supply. So if it has no blood supply directly to it, how's it going to get nutrients? How's it going to get oxygen? How's it going to heal? How's it going to get toxicity out? And the exact mechanism I showed you, the pump mechanism, is exactly how this disc gets blood supply, oxygen, nutrients in, and gets waste and toxicity out. So we want to make sure that the bones are in proper alignment, sitting on the disc properly, and you've got proper pumping mechanism. That is the proper mechanism of disc health. If we're sitting here today and we're suspect you have a disc problem, chances are that pumping mechanism is no longer functioning correctly. And here's why. As soon as you, over time, bend, twist, and turn the spine out of alignment, the vertebra, the bones, will start to shift, bend, and twist. And if you don't get them put in alignment, they lock there. And then they start putting pressure on the disc where it doesn't belong, and you get more pressure, and you get none of that pumping mechanism. So as soon as the bones shift, instead of pumping, you get pressure. And there's three types of injury that will happen to the disc over time. The first one we call a disc bulge, where there's pressure where it doesn't belong and the entire disc bulges. If I had a piece of hamburger meat in a ball and I squeezed it and it bulged out, that's the first thing that happens to the disc. It bulges. And as it bulges, it starts to weaken the disc itself until ultimately there's enough pressure, and then you have what's called a herniation. A herniation is a blip that comes out and starts to interfere with the nerve. Now, this is where pain really starts to happen. This is where you might have pain, numbness, tingling down your arms or down your legs. When you've got a bulge that's putting pressure on a nerve, or you have a herniation that is now popped, you're either putting pressure or chemical irritation causing numbness, tingling, burning, pain down the arm or leg. Eventually, when you lose enough fluid, then all of a sudden the disc thins out completely, and we have what's called a degenerative disc. So to recap, you need a normal pumping to get the disc healthy. When the bones slide out of alignment, you prevent the normal pumping, you put pressure, and then you develop a bulging disc, a herniated disc, and then finally a decaying disc, or phase 3. Now at that point, when the disc pumping mechanism doesn't work any longer, or no longer works, then you're going to start to have a decaying and degenerative disc and spine. At that point, your pain is going to really be there. You might have stiffness, soreness, pain, numbness, tingling, or you could even have bladder and bowel problems at this point. So how do we determine that there's a disc problem? The number one way that we determine is MRI. That is the gold standard. That's the number one way. You cannot tell 100% what kind of disc problem you have unless you have an MRI. So as we've analyzed your x-rays and we've done an examination in the room and we thought you have a disc problem, we've sent you for an MRI, and sure enough, we've gotten results. And in just a few minutes, we're going to go over your results. And if you have a disc herniation, a disc bulge, or a degenerative disc, I want you to know, chances are we're going to be able to help you out. So that's the good news. And I'll be in to tell you specifically if we can or can't. But I want to talk now about the different options that you have. So the first option is your medical option. That's where they're going to come in and they'll do two things. They're either going to take a scissors, they're going to do surgery, and they're going to cut this little blip out. That's called a discectomy. The problem is they do nothing to heal the pumping mechanism, and sometime between 3 and 5 years later, you have a reherniation occur. I know because I've seen this time and time again. If they don't do a discectomy, then they'll do a fusion. They're going to cut these bones here, the 4 bone sides. They're going to pull this out, expose your spinal cord. They're going to take the disc material out, and then they're going to put rods in and they're going to fuse you. That's called a spinal fusion. Ladies and gentlemen, I'm a statistics person. So between a discectomy and a fusion, there's a 74 to 80% failure rate, meaning you feel no better, the problem hasn't been fixed. As a matter of fact, insurance companies have a name for this called failed back surgery. For many years in Chicago in my practice, we used that term, failed back surgery, 74 to 80% failure rate. Your second option, okay, in the medical world, besides surgery, is shots. Shots like cortisone or epidural. The problem is there is no research behind how successful they are, and they're dangerous. The third option is what we call opioids or pills. Did you know that if you take a pain pill, within 1 week, you're addicted? So you've got your medical model. The problem is we're not solving any problems that way. And 80 million Americans still suffer back pain. 74 to 80% failure rate. Your other option is something called non-surgical spinal decompression. We gave you a folder, we gave you some research, and we showed you that research-wise, non-surgical spinal decompression has a 74 to 92% success rate with a 4 years later, still 74% success rate, meaning the pain is gone and the disc itself is healed. Now I want to talk to you a moment about non-surgical spinal decompression. I want to talk to you about some of the things you might have seen, heard, or watched about that. Now, I'm going to tell you between this office, South Bend, Fort Wayne, Angola, there's lots of chiropractors who advertise non-surgical spinal decompression. And I'm going to tell you that it's false. I am the only nationally certified doctor who holds a degree in non-surgical spinal decompression in a 200-mile radius from here to Indianapolis. And I have the only certified national decompression table in a 200-mile radius. So what is everyone else advertising? They're advertising decompression, but truthfully, their equipment is not FDA approved for real decompression. They are what's called traction tables, but they're advertising as decompression. So if you've heard results not so good before, you've heard something, it's because truthfully, they're not true decompression tables. See, what the traction tables do is they pull the entire spine open like an accordion. The problem is, if we just need to target all of our energy at one segment, we're wasting a lot of energy. So, would you rather a 50% success rate or up to a 90% success rate? What makes our table so unique? It's an AccuSpina table. It is the finest piece of equipment to help non-surgical spinal decompression patients. Why? Because it's got 2 patented pieces to it. Number 1, it's got a 7-foot tower, which allows me to target the one specific angle and segment disc that we need to target, putting 100% pressure or focus on the one segment. And what this table can do is relax all the muscles around the one segment, put it on the angle, and then it stretches it. And what that does is when you relax the muscles and stretch the segment, it creates a vacuum. That vacuum sucks the disc material back in. So we start to go from this to that. As we suck the disc material back in, we also start to heal the disc. The second thing that a true decompression table does is it's called oscillation. Patented technology, meaning no other technology has this than our AccuSpina, and it's a reason we get up to a 92% success rate is we fix the pumping mechanism. There's no sense in bringing the disc material back in and not fixing the pumping mechanism because that'd be no different than a discectomy. So the second major thing that our table does is it actually has what's called an oscillation feature, which means as we're putting the spine back in place and we're sucking the disc material back in, we're actually reteaching the spine how to actually pump in a proper manner to get nutrients in and oxygen in and lactic acid and toxicity out. So the beautiful thing about what we do here with non-surgical spinal decompression is it's non-surgical and it's got up to a 90% success rate. So we've either given you studies or we will give you studies that are based on the Mayo Clinic, Johns Hopkins University, studies that are done by major orthopedic surgeons, major neurosurgeons that show that true non-surgical spinal decompression, when done correctly by a nationally certified doctor, gets up to a 92% success rate in handling, correcting, getting rid of the pain, and stabilizing the disc. So in just a few minutes, I'm going to step in and we're going to look at your x-rays, and I'm going to show you why you have a disc problem, and then I'm going to show you what type of disc problem you have, and then we're going to let you know based on research if we can definitely help you out and what it would take. I'll see you shortly.